Good morning, everyone. Should I share my screen?
Please, please.
Yeah, I hope my screen is visible and I am audible.
Yes, sir.
So, first of all, I like to thank Dr. Pramod Bhende sir for including me in this interesting debate session, and also for trusting me to defend this difficult topic in today's scenario. So, I'll present my view here. So we know that Vegf remains the most important factor in the pathogenesis of PDR, and most of the factors which have been described ultimately work through anti-VEGF. So it makes sense to target anti-VEGF, the VEGF. Now all have been talking about DRCR protocol S, and I'll just comment on it in a single slide. It was basically an inferiority study, and what we found actually that it had certain advantages over panretinal photocoagulation, the monotherapy with ranibizumab, in terms of lesser rates of DME development, lesser rate of vitrectomy, and better improvement in the visual acuity. Now, the same thing was shown by a Clarity study where aflibercept was superior to the standard panretinal photocoagulation in terms of regression of neovascularization, in terms of resolution of vitreous hemorrhage, in terms of needs for vitrectomy, and in terms of development of macular edema. But were these studies conducted out of blue? No. So there was ample data even before these studies in terms of RISE trials, VIVID and VISTA trials, and Panorama trials, that most of the patients who received anti-VEGF therapy had at least 2 steps of regression in diabetic retinopathy severity scale when followed up over a period of 1 to 2 years. Now, we all are familiar with side effects of panretinal photocoagulation, and we have all seen this kind of picture where the patient has undergone photocoagulation extensively, but the neovascularization just refuses to go away. This is associated with the loss of peripheral field, night vision problems, and frequently it is associated with macular edema, increase in macular edema, which again would require anti-VEGF injections. And we all know that in 5 to 10% of the cases, there is progression of disease in spite of this is the recent study which has shown pictures like this, and where there has been people have been ultra responders. The retinopathy has virtually disappeared with 4-step improvement in up to 1/3 of the patients, and they have been now termed as ultra responders. Now, some may argue that anti-VEGF injections require repeat injections and follow-up. But remember, we regularly use monthly injections in AMD. And for DME, we started with all the studies started with 1 injection, but now we regularly use monthly injection when we found that, and actually anti-VEGF monthly injections were better than the macular photocoagulation. In fact, one of the quotes in Retina Today back in 2006, one of the surgeons commented that in my experience, anti-VEGFs really work well, and after a few years, will not have to laser macula. I think that is very much a reality now, and few years down from now, we won't have to laser even for PRP. And tell me a single chronic disease which does not require a regular follow-up. In fact, several long-acting anti-VEGF options are in pipeline, and I see from now, 5 years from now on, we will not be lasering and destroying the retina. Anti-VEGF injections are costly, but we have all seen the cost of the anti-VEGF injections have come down quite significantly. We can use bevacizumab, several generic bevacizumab injections for eye use are in pipeline. But then quality comes at a price. We all have seen that phaco gives much better results, but is more expensive. But we don't go after the price, we go after the quality and the outcomes. And as the technology advances, anti-VEGFs and the long-acting anti-VEGFs are going to become cheaper. The risk of endophthalmitis, we have seen that it is quite significantly low, and patient selection is paramount as in all treatment decisions in medicine. To conclude, anti-VEGFs cause fast and effective regression of neovascularization. Anti-VEGF downgrades the diabetic retinopathy and avoid the side effects of the laser and prevents the destruction of retina. Thank you very much.